Hey everybody, this is Todd, the Director of Content at Beyond Type 1, and I'm very excited today to be joined by Charlie Kimball, a Indy series car driver. I think I got that right. Charlie, do you want to quickly introduce yourself for the watchers, viewers?
Well, my name is Charlie Kimball. I drive and will be driving the number 4 Novo Nordisk car for AJ Foyt Racing in the NTT IndyCar Series. This year, I will be my 10th year in the IndyCar Series. I'll be attempting to qualify for my 10th Indianapolis 500. I was diagnosed with type 1 diabetes in 2007 at the age of 22 while I was racing in Europe. After working with my healthcare team, including Dr. Ann Peters at USC Medical, I got back in the race car and haven't let it slow me down, bad puns and all.
Great, yeah. That's so cool that your endo is Dr. Ann Peters, and we love her here. I've been talking to her about coronavirus every few weeks, so I'll probably ask you more about that later. So obviously there's a pandemic going on right now. Forgive me, I don't know actually what IndyCar season is exactly. Would you be racing right now? What's the current status? Like if it had started, when did it get paused? Can you just tell me quickly how has it affected your racing season?
Yeah, our IndyCar season runs very similar to baseball. Starts in middle of March and typically finishes middle of September. In fact, I had headed down to St. Pete, Florida for the first race of the season. And while we were there, it was that crazy week where the NBA suspended, the NHL suspended, golf tournaments got canceled or postponed. NASCAR events were starting to plan to run without fans and then got postponed. And from when I got to the racetrack Thursday morning, there was a press conference saying it's going ahead. That afternoon, they said, we're limiting it to essential personnel and no fans. Then on Friday morning, they made the decision to postpone or cancel the race. And so from being there, being all set up, getting amped for the first race of the season, to getting on a plane, coming home and rejoining my family and staying home for the last 4 or 6 weeks since. So it was kind of a whirlwind 48 hours there, coming off a whirlwind 48 hours because I had just left the hospital. My wife and I welcomed our second child just a day before I left to go to the first race. And so with that kind of whirlwind going on, and the introduction to this new normal of stay at home, it was pretty busy for sure for those few days.
Awesome. Well, congratulations on your new son or daughter. That's really fantastic. I guess if there's any silver lining here, it's that you've been able to, not only have you been able to stay home, you've been forced to stay home with the newborn. Can you tell me a little bit about what life at home has been like for you the past 6 weeks? I mean, I've been sheltered in place. I think we've all been sheltered in place for around the same time. And as someone living with diabetes, especially, there's concerns about making sure you have all your medication and making sure your blood sugars are well managed. How have you been dealing with living at home with a newborn, with diabetes, during all of this?
It's been really busy here at the house. My wife and I have 2 kids, both under the age of 18 months, a daughter who's the 18-month-old toddler, and then our son who's now 6 weeks. And it's been really busy, and we've been trying to manage keeping our toddler entertained and keeping our son healthy, keeping ourselves healthy, managing my blood sugars, trying to schedule in time in the office, but also workouts, managing my blood sugars through getting some activity in. When the weather's good here in Indianapolis where I live, getting outside for walks or exercise, working out in the garage with my trainers online, but also making good nutritional choices. I think that's a big part of it for me, at least, is it helps me manage my diabetes. If I can make the right nutritional choices, get a little exercise in and chase my toddler around the house as much as I can.
Have there been any changes to your blood sugars? It's interesting. We've been hearing, people are really stressed that some people's blood sugars have been out of whack, but some people have, really appreciated having this regularity and actually seen that their numbers have been better over this time. So I'm wondering if you've noticed any trends or any differences.
For me, I've noticed a little bit of both. I've noticed that my blood sugars have been better and more stable because I've had better nutrition eating at home. If I was going back and forth to the racetrack and spending that time eating out on the road, it's a little harder to manage and a little harder to predict. But eating well at home, it's been a little easier to manage. But then the stress of managing staying at home and not being at the racetrack, not doing what I love, has made it a little harder. So it's a little column A, little column B for me. But I know that the stress and the anxiety, a lot of people are struggling. You know, I have good days, I have bad days. I think having that support system has been really important to me. Having those resources to reach out to. If it's my wife, to let her know I'm struggling, or she let me know she's struggling, or if it's online resources. I know your website's got a lot of great resources. My partners in Novo Nordisk, their Novo Care website is a great opportunity for people to get some help. If it's getting help with, you know, the cost affording medications, if it's help with other places that they're able to get some support. I think that having that support system is really important.
And how are you currently managing your diabetes? Do you wear a CGM? I think I had read in our previous interview with you that you didn't wear a pump. There was some concern about the insulin overheating under your race suit. So are you still on MDI? And then also, are you wearing a CGM? What are you doing currently?
Yeah. So as the son of an engineer, I'm a very data-driven person. You know, especially in racing, I'm all about the data, all about the engineering aspect, and so even in my and especially in my diabetes management, I'm very data-driven as well. I use a Novo Pen Echo, so I am still on multiple daily injections. I use Tresiba for my long-acting insulin. I use Fiasp for my mealtime fast-acting insulin in a Novo Pen Echo, so I can keep track of those doses. And I pair that with the data that I get from my CGM. Typically in the race car, when I'm at the racetrack, that CGM plugs into the car's data system. So my blood sugars are part of the data that the race car produces. So it's making sure my car's running right, making sure my body's running right as well. Here at home, you know, that it looks a little different. It's connected to my phone and my watch, and I upload it to Dr. Peters through the online resources and online tools. But I'm able to use that data in my management to try and stay on track and keep those windows as close as I can.
What was that process like after you were diagnosed getting, or when did that happen that you were able to get we've spoken with one other race car driver, Ryan Reed, and I know that he also has his CGM data up on the race car. And I don't think I asked him specifically, but when did that happen? When did that occur? Was that a difficult process? Was it easy? Like, can you tell me a little bit about being able to view your CGM data on your dashboard?
Well, originally it started with the high-tech science of Velcro, and I Velcroed my display to my steering wheel. But it's evolved from there, and to be able to get it into the data system took a lot of work from the engineers within the race car who understand how the data electronics work within the race car systems. Now that it's on my wheel, it means that we can log it and I can do some analysis on the backside. I work with an exercise physiologist, not only on my physical training, and he works closely with my trainer in my gym, Pit Fit Training here in Indianapolis, but also works with Dr. Peters on how to manage my blood sugars to be more effective within the race car. And we can look at analysis of blood sugars and performance. And the regression analysis we've seen is that over the last few years, my diabetes hasn't impacted my results any more than the weather or pit stops. You know, things like that have had a bigger impact, which to me is fantastic as far as leveling the playing field.
Excellent. And so I know that you can't weigh in on this with any scientific accuracy, and we certainly won't hold you to this, but I'm just wondering, like, what does your gut tell you? Do you think you're going to be racing again this season? Any ideas as to when? I mean,
it's hard because I miss being at the racetrack. I miss representing the diabetes community on the racetrack. I miss inspiring that group of people. The Race with Insulin program with Novo Nordisk, we've been able to reach thousands of people to help them or encourage them to try and chase their passion. If it's an athletic endeavor, running their first 5K or half marathon or full marathon or ultra marathon or whatever that is, being at the racetrack for me, it lends so much to what I do as somebody with diabetes and as an athlete. My gut, man, I think it's going to take a couple of months, but I think them rescheduling the Indy 500 to August, which is unprecedented, it gives us the best opportunity to put on the greatest spectacle in racing, and still run the Indianapolis 500 in 2020. I'd love to be at the racetrack tomorrow, but I think that it's important that everyone does what we can, and we're all in this together to shorten this time frame where we're stuck at home.
Yeah, I've definitely been feeling the absence of sports in my life. I'm a big baseball fan myself, and I'm usually starting to go to games around this time. I think it's really made us all realize just how important sports are in everybody's lives. I mean, it's important to the economy. It's a lot of what I've been watching on television. It's, a really great escape for people. So I'm also hopeful that in some form, whether it's without fans in the stands or however they can do it, I'd love to get all these sports back up and running as quickly as possible and safely as possible.
I agree. And as a baseball fan myself, as long as you're not a Giants fan, oh no. I'm sorry. I'm a Dodgers fan.
You're talking to someone who's lived in the Bay Area for 25 years of my life. The only exception actually was when I was down at UCLA. So I've been to my fair share of Dodgers games. I think I see a Dodgers cap in your background there.
That is a Tommy Lasorda signed Dodgers cap. So I bleed blue. I'm a big Dodgers fan. So I think you're right that sports are a great escape for people to watch on TV. I look forward to sitting down on a Monday night, especially after a race weekend, and doing my race report with Monday Night Baseball on. And I think especially during the summer and baseball, and now we should be in the NBA playoffs and seeing how our Pacers are doing, the NHL playoffs. I think playoff hockey is some of the greatest drama in sports. And, we usually get to this point of the year. So it is such a great escape for people that when it's safe and we have that opportunity, I'd love to see sports start to roll back out. But I do think it's important that as a country, we do it intelligently.
Absolutely. Well, thanks so much, Charlie. I mean, I think that's all the questions I had for you today. I will just give you the opportunity if there's anything else you want to say, any advice you have to all the people with or affected by diabetes who might be stuck at home watching this right now.
Well, I think the best piece of advice that I have to offer is we're all in this together. And even we have good days. We have days when we struggle a little more. There are resources out there. Beyond Type 1 is a great organization for those resources. I think Novo Nordisk and the NovoCare website is a great opportunity as well. If people want to follow me on Twitter at Race with Insulin, on Twitter at Charlie Kimball, my website's Charlie Kimball as well. They can keep up to speed with me when we get back to the racetrack and get racing again, Todd.
All right. Great. Thanks so much.
Thanks for having me.
Bye.